Hi, I'm Mark at Physical of Eversville. Hope you had a great holidays this year. Two things I want to talk about. Number one is, first thing, I want to give those of you who've been following my updates on my shoulder surgery. When you see this, I'll be 12 weeks out. I want to share with you what I'm doing now and what I've been doing all along. First thing that I want to tell you is I have made a steady diet of body weight squats starting the second or third day after my surgery, just to stimulate the lower body, because if you don't have your lower body, doesn't matter what you got upstairs, it's not going to matter if you can't get around or if you can't get up and down out of the chair. Plus, when you train the lower half, there's a carryover effect to the upper body. So I started doing between 100 and 200 body weight squats a day. Nice and easy. I'm able to keep my both arms out of it, so I'm not stressing that, but getting my heart rate up some and just maintaining that lower body strength. It's a great way to get some exercise in, get your heart rate and breathing. Second thing, what I'm doing, I've now progressed to more range of motion in my shoulder. I'm still not at the stage yet where my doctors released me to be strengthening it, so I've done no strengthening on it yet, but I've continued range of motion. Currently, what I'm doing now and what I'm going to recommend to you all is get in a doorway or a bar, and what I'm doing is take it, so this is my surgical arm, I'm taking it up overhead, I'm lightly gripping, I'm going to just go to where I'm comfortable, so I'm not going to force it, but once I get to where I'm comfortable overhead, and for some of you, it might be down lower. Just keep that in mind. It's just wherever you can get to comfortably. But I'm going to show you here, because this is where I'm at now, and I'm going to just gently rock my pelvis forward and back a little bit, just to get a little gentle stretching through there. So I'm going to do 10, 15 reps of this. Then, same arm position, I am going to, and I'm going to turn a little bit so you can see me from the back a little bit. I'm going to drive my pelvis to the side, both ways, so that get a little bit of side stretching to that. And then the last position overhead, I'm going to just gently rotate my pelvis clockwise and counterclockwise to get a little bit of rotation there. All the time keeping it below pain or less than a one level pain and not forcing anything. Part two, I'm going to hold on where I can, chest height, a little bit lower again wherever you're comfortable. I'm going to turn away from it a little bit so my arm is a little bit across my body again where it's comfortable. And I'm going to rotate both ways, but the stretching is more going to come as I rotate to my right. But I'm still going to go both ways, just nice and easy to get this stretch across your body. Part two, I'm just going to turn the other way and just go to where my arm is comfortable behind me and gently rotate here. Again, it may be different for everybody where you go to. Do not force anything. Do not try to increase your pain levels. The last one then I'm going to do is for reaching behind. So I'm going to just grab something low. I'm going to step forward just enough to where I got just a little bit of pull on there. And then I'm going to just bend lower, again driving hips back and driving them forward, where I'm getting a gentle motion through my shoulder this direction. So you can add these to your repertoire. Keep in mind where the height that you use may be different for everybody. You're not forcing anything, you're not going to pain. Keep your pain level 1 or less. Don't think that you can force a stretch. You've got to be very gentle. Respect the repair. We'll start working on getting that range of motion. And above all means, whatever your doctor has told you, make sure you stay within those guidelines also. If you have further questions, contact us at physicaloveversville.com.